Good evening to all. Welcome back to another session of Cancer Care at American Oncology Institute, Ludhiana. Today we have with us Dr. Jagdeep Singh, Associate Professor, Medical Oncology at DMCH Cancer Care Center in collaboration with American Oncology Institute, Ludhiana. Today we will gather information about breast cancer. So good afternoon.
Good afternoon to everyone. Thank you.
Sir,
Dr. Jagdeep, I'm Associate Professor at Medical College, DMC Ludhiana in the Department of Medical Oncology. So today we'll be going to have some discussions on the breast cancer, what are the signs, symptoms, prevention. So one by one he will be taking the questions and whatever the answers will be answering. So over to you.
okay. Sir, what is breast cancer and what are the signs of breast cancer?
So itself name denotes that cells in the breast, they keep on proliferating and they don't die. And this uncontrolled growth of the cells is called as the breast cancer. And signs vary from different stages of the breast cancer. Even in the early, sometimes we don't know, we don't have any signs or symptoms. And usually sometimes it is incidentally detected during some sort of investigations or some sort of imaging. But when the patient have some advanced disease or the lump size is very large, then usually presents with the lump in the breast. Patient can present with the inverted nipples, change in the color of the skin of the breast, and there can be sometimes even the ulcerations. The patient can even present in the very advanced stages or the metastatic stages, that is stage 4, with the different types of pains in the body, bony pains, or patient has involvement of lungs, can present with the dyspnea. The patient has involvement of the liver, can present with the jaundice. So depending upon which organ is involved in the advanced or metastatic stage, patient can present with the different various manifestations.
Okay, sir. Sir, what are common causes of breast cancer?
So there are a lot of causes for this. The most important is the familial history, means there is some genetic risk factors, or also hormone risk factors in the form of patients who are taking hormonal therapies, and patients who are nulliparous, means they have not given birth to the child, the patients who have not breastfed their childs. There is a lot of factors contribute to this breast cancer.
Ji. Sir, what should be the next step after detecting breast cancer?
So once a patient gets this diagnosis, or once a patient is labeled that she's having a lump in the breast, so definitely she has to go to different modes of investigations to diagnose which stage and what is the appropriate treatment for that stage. So starting from biopsy, which is a most important and foremost things, to prognosticate what different types of cancer forms are, there are different forms in the form of hormone positive or HER2 positive or triple negative breast cancer, which have different outcomes. So we have to tell the patient that different breast cancers or different forms of this can have a different outcomes. So we have to investigate those. Then definitely nowadays we have a PET scan in our armamentarium. That is, we have to do all the investigation in the form to diagnose whether the disease is localized or it's a widespread, because your further treatment depends upon the stage of the disease.
Ji. Sir, what precautions should be taken to prevent breast cancer?
So most important thing, just I previously pointed, familial history if is there, so patient should be more vigilant regarding these. If they have any subtle symptoms or very small lump in the breast, they have to get it checked, or they have to show to the physician or to the surgeon, and they have to get it properly investigated. Other things most important nowadays, we have a very economical source of screening is this mammograph in the form of a digital X-ray mammography, or it can be the form of ultrasound. So we usually recommend to the female from the 35 to 40 years of age group to get a yearly mammogram done every yearly till the age of 75. So the more we screen the patient, the more early we get the disease detected at an early age. So by this, a patient can be saved from the financial toxicity or financial trauma, psychological trauma, and even the family passes through a lot of pains. And all this we can reduce if we do a proper screening of the patients.
Ji. Okay, sir. So can breast cancer detect at early stage?
Yes. This is what we have just pointed. So screening is the most important tool. In our country, in our society, very means we have a lot of population, and we have to do a screening which is very cost effective. That is the most important thing. So it should not make a high burden to the patient's pocket. So you can get this sonomammography done or ultrasonography done at a very cheap cost, maybe close to 1,000 rupees, and this can definitely make an impact on the patient's life if she is get detected that she's having a breast cancer.
G. So does family history matter in breast cancer?
Yes, definitely. So this is a lot of predisposition, or there is a lot of chances that there is a strong family history we have to take into consideration, especially in the young female patients when they are presenting and they have a family history. We have to keep high level of suspicion that most likely they could be having some breast lump or breast cancer, which can be detected by the different means.
Okay, sir. Sir, what are different type of therapies which we use in breast cancer?
So breast cancer, when we are talking of breast cancer, it's a basically multidisciplinary team involving all surgical oncologists, radiation oncologists, medical oncologists, again pathologists, and even the most important is the radiologist or the nuclear medicine physician. So starting from the biopsy to the staging, and then later on coming to the treatment. If it is very early breast cancer, we can directly go ahead with the surgery. And there are different forms of surgery in patients who are young. They might be opting for the breast conservation surgery. The patient is not concerned for the breast conservation, can go for the total mastectomies. Similarly, in the form of chemotherapy, we have a lot of drugs which we give. And there are a lot of targeted therapies which are available right now, which can give a very good result and with a very less toxicity. And even those target therapies which were initially not affordable for all, now we have into our range and we can get that. And similarly, when the next comes the radiotherapy, another important tool in the treatment of breast cancer. So we have different machines with a different delivery systems. So depending on the patient's preference, we can give radiotherapy to the patient.
Ji. So in case of breast cancer, what would be the treatment taken by the patient?
So this is all the which I just pointed out initially, that surgery or targeted therapies or the radiotherapy or hormone therapy, these are all the different type of therapy which we can give to the patient. In the metastatic or even the advanced settings, there are now a lot of new drugs which have given a very good lifespan to the patient who are even presenting in the stage 4 in the hormone positive breast cancer. And nowadays we are talking of the survival, means even in the stage 4 breast cancers, we are talking about 5 years survival. So we have a very good number of drugs, and with the latest researches and advances, we can increase the patient survival.
Okay, sir. So what are the possible side effects of each treatment?
So depending upon different therapies, if you go for the surgery, that means if you patient go for the total mastectomy, so usually sometimes patient present with the lymphedema. Most important is the cosmetic effect. Females are concerned that the cosmetics is one of the important concern. That's why breast conservation came into the application. Patients do not want to feel, or they sometimes do not want to make themselves like embarrassed that they didn't went for surgery or like this. Similarly, in the chemotherapy, you can have a different side effect profile depending on the loss of means decrease in the hemoglobin, TLC decreasing, or the platelet reduction. Other things can be in the form of involvement of liver involvement or some other drugs which are involving different systems. So all different depending which target therapy you're using. Like if you're using trastuzumab, you have to be aware of the cardiac related side effects, patient baseline echocardiography. Similarly, if the radiation is there, so you have to expose the patient in such a way that area should be covered in such a way that we don't have a more of toxin in the nearby periphery areas. So these are different type of side effects which we see in our day-to-day practice.
Ji. Sir, does breast cancer treatment affect everyday lifestyle in patients?
So not exactly, because now we have a lot of therapies which have made the life of the patient are very comfortable, and good support system and good patients counseling and patients commitment to the treatment. And if the patient is well versed with all these things, of all this knowledge, I think, and it doesn't make any change in the patient's life. And moreover, the outcomes are good, and patient can think that they can have a good outcome and they can have a normal life that what we are expecting for a patient, that it should not be taken in that way that cancer is not curable.
G. So any suggestion or instruction to our viewers for healthy lifestyle?
So definitely screening is the most important tool. Next, we have to like sedentary or obese things like obesity is one of the another important you can say a risk factor. Hormonal therapy exposure or familial history that has to be taken into account while we are thinking. So I think this all sums up what we have to do and what don't we have to do for the specific thing.
Thank you so much for sharing this important information with our viewers. And thank you so much, viewers, for watching our session of cancer care. If please subscribe our channel, and if you have further queries, you can comment in our below video. Thank you so much. Thank you, sir.
Thank you so much.